Welcome to the Second Reading Podcast from the University of Texas at Austin.
The Republicans were in the Democratic Party because there was only one party.
So I tell people on a regular basis, there is still a land of opportunity in America. It's called Texas.
The problem is, these departures from the Constitution, they have become the norm.
At what point must a female senator raise her hand or her voice to be recognized over the male colleagues in the room?
And welcome back to the Second Reading Podcast for April 30th, 2021. I'm Jim Henson, Director of the Texas Politics Project at the University of Texas at Austin. And today I'm joined again by Josh Blank, Research Director for the Texas Politics Project, for a special edition of the podcast that's going to look at the body of data that we've accumulated in a year of polling in Texas on the COVID-19 pandemic. So welcome, Josh.
Oh, thanks for having me.
And congratulations on all the work that you have done on this year of polling. I haven't taken the chance to look. We've talked about looking. Mm-hmm. I don't know that there's another comparable set of state data to the data we're going to talk about today.
You brought that up the other day, and it was like one of those things, and no offense, boss, in one ear, out the other. Like I'm sitting here trying to process this. And I'm like, oh yeah, let me go look for the other polls out there. Given
the list of things we need to do, I didn't expect. But you keep an eye out, and I was wondering. I figured if you knew about something at the time, you'd have spoken up.
I've seen a lot more national stuff. I haven't seen too much state, and we're pretty tapped into that. I mean, based on like professional organizations and stuff like that. But I haven't seen much. I haven't seen something very similar to this set of data that we've been accumulating at the state level.
Yeah, I think that's right. So we're just sitting here virtually patting ourselves on the back. Mm-hmm. And we invite somebody, and actually this is really serious. If you do know of another series of polls in another state, we'd love to have the comparative case, and just hasn't come across our desks yet, or into our inboxes, whatever metaphor you want to use. So we're releasing this podcast to coincide with the initial release of results from the April 2021 UT Texas Tribune poll today, and that's, April 30th, depending on when you're listening to this. And if you're listening to this on the 30th, there'll be a lot more interesting results released on Monday and Tuesday of the following week, this coming Monday and Tuesday. So there's a lot in this poll, but today we do want to focus on the COVID stuff, because what we've done is gather a pretty big, to use the technical term, pile of data on Texas attitudes towards the pandemic. Now, a little background. At the outset of the pandemic, we made an early decision in 2020 to increase the number of polls that we were executing as the pandemic began to sort of rear its ugly head. So we added a poll to our 2020 data set, and then increased the number of polls that we had planned for 2021, both in conjunction with our frequent partners at the Texas Tribune, as well as some standalone polling and some stuff we've done in collaboration with others at UT Austin. So now we have a series of 5 polls going back to April of last year, that have significant batteries assessing Texans' experience of the COVID pandemic. We don't have a complete battery. Everything isn't exactly the same or identical from beginning to end, because some things aged out. Some of the questions we asked in the first part of the sequence weren't as relevant as the pandemic wore on. And as the pandemic wore on, some things popped up like vaccinations.
Right. We swapped out
kinds of behaviors.
We swapped out. Are you disinfecting your Amazon packages?
Yeah, stuff like that. Yes, there were some. I was going to be mean, but there's no reason to be mean. I mean, there was some learning that was going on, and the learning that went on in practice was reflected in things that we asked about it in the poll. So we have this, and so today what we thought we'd do is talk preliminarily about what we're seeing this, and we're going to do a lot more with this as time goes on, and there'll be lots of material on this in the blog as we continue to go forward with this. And we're not done. I mean, we will, the pandemic is not completely over. And even if it was, we'd want to get the wind down anyway. Although one of the themes today is that we're beginning to see at least some perceptions of a wind down among some Texans. So So let's talk about this, Josh, and let's start with some of the more immediate matters at hand that people might be interested in, that are maybe a little more, current and relevant, and nothing probably more so than vaccines.
Yeah, absolutely. Absolutely. I mean, I think, it was one of those things while we were in the field, the Johnson & Johnson recall happened.
Right.
And so, there's a possibility that would impact, people's attitudes towards vaccines. And actually, we didn't really find that. And what we're finding is that a lot, there's some sort of, glass half full, glass half empty about vaccines, at least with the data. That's
what's funny. I was going to ask you, we had talked about this and so have this be back processing. I was going to ask you whether you thought this was on balance good news or on balance bad news, since we've written about whether vaccine attitudes were good for public health or bad for public health. And on balance, up to this point, we've been worried, just to be fair.
Yeah, I'm going to say glass is half full, and I've got some reasons for that, but we'll put a pin in that. We'll come back.
Yeah, definitely.
So just to set the stage here, we asked a couple questions about vaccines. One thing we wanted to do is we wanted to separate out basically people's attitudes towards the safety and efficacy of vaccines in general versus their decision about whether or not they're going to go and immediately get a COVID vaccine. They're not, they're unsure, already have, that kind of thing. And so both in this poll and actually back in February, we asked people how much or whether they think that vaccines in general are safe and whether vaccines in general are effective. And then overall, just to make it kind of simple to discuss, we talk about vaccine trust as basically people who say that vaccines are both safe and effective in general. So in general, you've lived your life, you think vaccines are safe, you think they're effective, you basically trust vaccines.
And you should give a little polling technique footnote is why some people have just asked, do you think they're safe and effective? And we chose not to do that.
Well, right. Those are two different concepts, right? Ultimately, a vaccine could be extremely effective, but maybe, your legs will fall off. Well, that's not safe, right? And
you might believe your legs would fall off.
Right. And well, I'm just making, this is a hypothetical, right? But similarly, you could say, I think vaccines are totally safe. They're just not going to do anything for me. And so that's why we wanted to break out each of those factors just to be, really clear about it. But then we ultimately combine them back together here.
I think it's an illustration of how we're willing to do things that are kind of a pain in the ass in order to be better and more accurate, more precise. Because this has been, more work and more time, and the extent that time is money on a poll, more expensive.
Yeah, I'm just near having my head spin. Think about what you just said. Anyway, yes, we make it harder on ourselves for you all. So anyway, the people. So in this poll, we found, overall trust was at 61%, which is, kind of damning with faint praise a little bit, right? Because ultimately there's 39% of Texans who are less than trusting of vaccines in general, which I think is part of the broader context for, half full, half empty here. But that's up, 5 points from February.
Technically, barely more than half full.
Yeah, technically, barely. Well,
10% more than, yes. 10 percentage points more than half full. Okay, go ahead. I will let you get through this, I promise.
Sure. You can promise what you want. So anyway, up to 61% from 56% in February. I think that's, good numbers because of the fact that shows, increasing education efforts are having at least a slim effect on people, because this happened despite the fact of the Johnson & Johnson recall. The biggest gains we saw over this period from February to April were among the groups that honestly, we know need to get vaccinated at higher rates than they are. So 18 to 29-year-olds, their overall trust of vaccine increased by 18 points. Rural populations expressed 17 points higher trust in vaccines. The Black population saw a 15-point increase in their trust of vaccines. So in general, these messages that are out there that are trying to mobilize communities towards the safety and efficacy of vaccines seem to be hitting their intended targets. Same time, though, there's still low levels of trust, in particular among Republicans. So overall, when the lack of trust is 47% among Republicans, 48% among conservatives, 43% among Republican women. So, ultimately it's sort of, again, half full, half empty on the vaccine safety measure, but it's getting better and it's hitting at least its intended targets.
Right. And even among those groups, like among Republicans and a lot of those groups you mentioned, you did see some movement on trust. But I guess ultimately Republican trust went up stayed about the same, I guess.
Right.
So they all were fairly stable now that I look at this. I was thinking some of them had moved, but they didn't.
So then, we asked another question about vaccines, the $1 million question here, which is basically, are you going to get a vaccine as soon as it's available to you, or have you already gotten one? People could say yes, they already have, no, or unsure. On this measure, again, this is sort of I would say a half full, half empty result again. 10% of Texans, or I'm sorry, 64% of Texans said they either already have gotten a vaccine or will definitely get a vaccine as soon as it becomes available to them. 36% of Texans said either they would not, were unsure, or didn't know. This is, the lowest measure of hesitancy that we've seen in four polls that we've conducted going back to June of last year before the vaccine even existed. So on the one hand, that's a really good result. You want to see that hesitancy continuing to go down. On the other hand, when we look at the people who either say that they are definitely going to get a vaccine or already have, of the 64%, 54% of that 64%, so all but 10% of the total population, just to be clear what I'm talking about, has already gotten at least a shot of the vaccine. Now that sounds high, but remember, we're talking about voters here.
I was going to say, this is where we should flag that we're talking about registered, self-declared registered voters
right,
as our sample here.
Right. So this is a higher socioeconomic status group than the population of the state as a whole. So we'd expect higher rates of vaccination. The problem is only 10% of the sample said, yes, I'm going to go get a vaccine, after the 54% who said they already did. So when we're sitting here talking about the demand problems that are cropping up in a lot of areas where now supply is starting to outstrip demand, this is actually a really good encapsulation of that, because what you're seeing is that the people who wanted vaccines have mostly gotten them. There's a small share of people left, at least in the voting pool, who say they still need to get one. And the remainder now are at the people who are hesitant.
Right. Now, again, I thought you were going to go a little more with the half full on this. I mean, the hesitant number has dropped from 48 to 36 between between February and April. Mm-hmm. So we are seeing, a little less skepticism of vaccines, though that number is still pretty high. The other thing we have to, probably put in here is that some of these people that are hesitant, and it's fair to say they're still hesitant, but may have had it. We've had what? I think a little over 2 million people in Texas have had the virus.
Yeah. I
think it's about 2.4. Then you have to 2.3 something. You have to take out of that. Unfortunately, the more than 50,000 people that have attributed the deaths that have been attributed to the virus, probably an undercount. Mm-hmm. So the vaccination level is a little higher. That hesitancy level might be not entirely hesitant. There may be some people in there that have had the virus and are just like, yeah, I'm not going to get it, or I don't know. And we don't ask that. So
yeah. And I think, and I said, and the reason I see this actually as being a half full moment is because, everything seems to be moving in the right direction, right? We are vaccinating more people. The polling data is moving in the right direction. The hesitancy is going down. The groups who we had identified earlier in the pandemic that had expressed resistance, in particular, like African Americans, are starting to show more trust and higher, basically stated intention to get or actually having received the vaccine. And so I think that's really important. I think the broader context and the reason this is a weird half full, is that when you say, well, how can it be half full if 39% of people don't trust vaccines? I say, well, look, my attitude on this at this point, having looked at this data, is that, not having an attitude about vaccines or not being sure about them is not the same thing as being resistant to vaccines.
Yeah, no doubt. Some of these people that were in those categories in earlier polling, the reason that some of those people have just gone and got a shot at some point.
Right. And the thing is, I think there's a sense, especially amongst, public health experts, people in the media covering public health, the politicians focused on, basically a vaccination campaign and programs to get people vaccinated as quickly as possible, might underestimate the extent to which, a lot of people just don't really think about vaccines. A lot of people don't get vaccinated for the flu, for example, for anything. Exactly. And that's how they live their lives. So that when you say, you need to go get a vaccine, what do you think about this? A lot of people have already made a decision that they don't get vaccines. And so now it's not about that they are never going to get a vaccine, but you have to overcome their initial resistance to vaccines, which is what we're seeing play out now.
Right. I mean, you don't get like some huge number of flu shot uptake. I mean, the highest levels of vaccination probably are among children, would be my guess, right?
And that's because it's basically required in most cases.
Yeah, you can't go to school in public schools without it, and probably some private schools, I assume. Okay, so then so let's then move from vaccines to something a bit more speculative, although it's already getting off the ground in places outside the United States, I think. And that is this notion of vaccine passports. And I've been interested in this, very interested in this, almost from the beginning of the pandemic.
Yeah, I was going to say, since about May of last year.
Yeah, I mean, I was sort of predicting, there's going to be a software application. There's going to be all kinds of, the market is going to respond to this. You know, and I would say I probably underestimated the degree, and I think foolishly, the degree to which there would be ideological pushback on this, although I honestly wasn't thinking that far forward. I was just in, you know, in wish fulfillment mode and also you know, it was a matter of social speculation too, to be fair. At the time, I was thinking about longer term responses to all this.
Well, and to be fair, you know, I think at the time that we started thinking about the idea of a vaccine passport or you know, I mean, first of all, vaccines did not exist yet. And the question was, well, if vaccines did exist, how did we start to kind of like restart society? But also at the time that you were interested in this, I think, you know, in particular, essentially the public health response, at least at the state level and, you know, maybe at the national level was, well, let's wait till we get a vaccine.
Right.
And so this was a more realistic discussion as opposed to then once we actually have a vaccine and the question becomes, you know, one of vaccine passports, AKA a government record of your medical.
Well, and in the early period when we thought that it was going to take longer to get a vaccine, it was also some mixture of saying, you know, if it turned out that you could only get it once, it would also be certifying that you'd had it.
Right.
That you had tested positive and we're no longer contagious. And that was folded into it. But be all that as it may, whatever was going on in my head at the time, well, you know, we did ask this time, do you support or oppose the use of a credential, you know, for example, a vaccine passport, we put in parentheses, for people to provide evidence that they have been vaccinated against COVID-19 in order to gain admission to events or activities with large groups of people. And if that sounds convoluted to you, it's because the question we thought required it, given that as we were putting the poll together, you know, that we were already getting the sense that vaccine passports were becoming, you know, politically symbolic in the way that, you know, that masks and various other aspects of this had become. And it would also, you know, passport denotes travel, et cetera. We just felt like we needed to spell it out. And so what we ended up finding was that Texans were almost dead evenly split. 41 supported, 42% were opposed, with the rest either don't know or ambivalent.
Right. And now, of course, and I think, you know, matching the, you know, if you're listening to this, you know what the political discussion around this has sounded like. 72% of Democrats were in favor of vaccine passports. 72% of Republicans were opposed to vaccine passports. Just to get away from partisanship for 1 second, you know, the non-white populations that have really borne much of the brunt of the coronavirus pandemic were more open to vaccine passports, 50% of Hispanics and 46% of Blacks compared to 36% of whites. People living in the urban parts of the state as opposed to rural and suburban parts were also more open to vaccine passports. So some of this is contextual, but I mean, just to, you know, to defend our convoluted question a little bit, you know, part of it is that, you know, I think the convoluted nature of it reflects the fact that it's actually a far more complicated idea than a lot of people really give it credit, right? So one of the things that we were talking about is, well, you know, will these be required or will they be, you know, something that you can do? Who's going to do the requiring, right? Is this something that you need to work? Is this something that you need to go to school? Is this something you need to attend an event for a leisure activity? Like if you want to go to a Spurs game, like what are we talking about here? So that automatically is a very different set of considerations.
And this has been a little bit of a political economy of the polling podcast, because we did sit, you know, for a moment, and we didn't have room to do this. We considered, well, one way to ask this would be, you know, would you, you know, which of the following would you want, you know, support or oppose using this or this being required? And then ask a bunch of those activities you were talking about.
Right, exactly. And I mean, I think, you know, based on the results of this item, I'm not sure we would have seen that much variation across the different, you know, contexts. But again, it depends on the context. It also depends on, you know, who is maintaining this data. You know, I mean, ultimately, I bring this up kind of not infrequently, but, you know, there's two kinds of federally protected data, educational data and health data. So the idea that people would be forced to provide health information, even as simple as whether you were or were not vaccinated, you know, it touches a lot of you know, privacy concerns and other issues. So
and I think that probably, you know, I mean, you know, to continue the thought that you started, I mean, the privacy concerns, I think, hit a kind of the ideology piece of this. But then there's also, and you were putting this in the, you know, as we were discussing this the other day, I think with Ross Ramsey, there's also a piece of this hit that just is the situation on the ground. I think you were calling it the people's experience or their lived experience. That is, you know, this is going to be a lot more meaningful, and the trade-offs are going to look different, even in allowing for privacy concerns, if you live in a dense urban environment versus a less dense suburban or, much less dense rural environment, there are just fewer applications.
Right.
Right.
Yeah.
And the way that you're weighing this out is just going to, is bound to be different. But that is something that overlaps as we know with the ideological thing. So they are all kind of entangled. Right.
Yeah. I mean,
and even the racial element in terms of, Hispanic and Black Texans being all things being more likely to live in denser urban environments.
But my guess is if vaccine passports are going to move forward in Texas in any way, it's going to have to be coming from the private sector.
Yeah, and and honestly, that's kind of I think that was kind of the direction they're going. And there's I don't know where it is in the process, but I believe there's legislation proposed that that's backed by the governor, prohibiting or limiting in some way the use of such of these such credentials.
The state agencies, at least, which is
right.
Common move for governments.
Exactly. Okay, so let's step back and look then a little bit at the arc of the coronavirus story so far and what we've captured over the last year. I mean, we've seen a lot of movement in Texans' perceptions of the urgency of the crisis and the degree to which they perceive threats. The more I've looked at this and the more that I've thought about it, it all seems to make sense to me.
Yeah.
I mean, I can piece together, when the time comes, I think a coherent story here,
right?
At least in the overall, thinking about how we might superimpose. This makes this like a working session podcast.
Yeah, no, I love that.
How we might, superimpose the trend data with, events, with event cut points.
Yeah.
I think that story is going to look pretty, like a pretty tellable, intuitive is a little too strong a word, but it's, I think the story is going to make sense.
Yeah, I agree with that. I mean, and I think we're probably thinking, odds are we're thinking about the same things here. I mean, we'll set aside, how much detail we need to get into in that story, but there's sort of two, I would say there's sort of a broad trend that we could say with some specific important pieces. And then there's a couple of key events, I think, that sort of break the trend a little bit. And so, I mean, from my perspective, when we first started polling a year ago, obviously there was so much uncertainty about this. Fear was pretty, I would say pretty widespread. Concern was pretty widespread, as you'd expect. We just didn't know. And then, what you could say is there's been a general trend towards less concern over time, which again, I think makes perfect sense for a number of reasons, right? When we know more about the virus, people were adjusting their behaviors. And it also, people were able to start to, I would say measure their concern against their own relative exposure and risk factors. And as we saw that happen, I think overall we saw little adjustments. And I say little adjustments because there's big partisan differences, but overall there were still, again, adjustments. Then there were sort of two things that kind of break that trend up a little bit. One, I think the surge in July. So once the state, basically once the
second surge was.
Yeah. So July was a big one where, sort of our June polling started to pick up, I think, a fair amount of an increase in concern after a sort of a big drop going from April. Is that right? Yeah. Right. And then I think another big piece of this would have to be when the variants started. So kind of going from the end of last year into the beginning of this year, there's a lot more uncertainty coming back up about, are these variants going to basically be a big setback for people?
Yeah, because I think we were expecting like some change in February and a lot of the things were kind of static between October and February.
And what's interesting, and I think, this is really, I mean, this is really a reflection, I think, of the vaccinations. I mean, it's really interesting because I think, you go and we ask people, for example, we're getting a little bit ahead of ourselves here, but to the behaviors people thought were safe. And between October 2020 and February of 2021, it was almost as if there was no movement on sort of the activities that Texans thought were safe to engage in. Go grocery shopping, go to work, go to haircut. The only one was, more people were confident that they could send their kids to school, which is, was true because there was more CDC guidance that this was safe. But then you look from February now to April, and almost everything we could ask people about saw a pretty big uptick in the share of people who say that it's safe. And I think that is, almost surely being driven by increased vaccination rates and, I think just generally people starting to feel safer knowing how to engage in activities.
Yeah, I mean, I think we're going to have to, do some more reading up on, a literature or, background. I don't know, although we all know more about it now than we did, which is kind of public health, what we know about, kind of public health perceptions. But
I've got something for the wrap up on that a little bit.
But as I think about it, it's sort of like, as I'm thinking about, okay, if we take the data on public attitudes that we have, and then there's going to be overlays. There's like a public health overlay that is kind of some of the things you're talking about. What are people, what's the situation on the ground? Right. Level of knowledge, level of, so maybe that's, I'm not sure exactly how would even think about what the thresholds are on that. And then there's just, there's going to be, we're going to have a set of political variables at the state level.
That's right? That's what makes it complicated.
Right. Which is what is, how do we think about it? At a certain level, it's like, governor declares emergency, governor shuts down, governor, then loosens shutting down, Shelley Luther.
Yeah, I was gonna say, where's Shelley Luther?
The Shelley Luther line. All of the, the election.
Right.
So there's a set of political variables on the overlay that are going to be interesting on that national state. So there's that.
I got to say, you just said something that really, like, I want to throw this out here because I hadn't really thought about this, but it's a really interesting thing to think about. So one of the things that we're kind of glossing over here are the different, and we've talked about this in the past before, but the different experiences of the pandemic between Democrats and Republicans, right? And we'll get there. I mean, the main gist here is that, Democratic concern has been consistent and extremely high, basically from the start of the pandemic until today. I mean, even to this poll, it's still extremely high. When we ask about, concern about community spread, when we ask about, concern about contraction, ask them to rate, the significance, for how big a crisis it is. It's been pretty consistent. Republicans peaked a year ago in April.
Right.
Then dropped consistently, and have seen some of these bumps, that we've talked about. But, it's interesting. You bring up the election, and that's, I think that's a really interesting point because, one of the things we think about, I feel weird reaching back into my political science bag here. It's like it's dusty. But I mean, we talk about, the purpose of campaigns is to, they call it enlightened preferences. Ultimately, most people are kind of floating around. They don't pay a ton of attention to politics, but they have an attachment to one party or the other. And it's interesting to think about the impact that, a year of being stuck at home in such a hyper-partisan environment during a presidential election cycle would go and reinforce people's partisanship, and the extent to which that partisanship reinforced attitudes about the pandemic.
Right. Well, and yeah, I think that's exactly right. I mean, that's broadly what that's pretty much what I was thinking, that, I think what we'd have to do then, I mean, we're talking about the overlays, but then the other thing is that the trend lines and attitudes, you're decomposing those as well and looking at the overlays and saying, okay, what does the overlay look like against the overall population? What does it look like again? Republicans, Democrats, even independents, and how do all these things interact, and what is the story that comes out of that? And the story I think is going to be, because, just in the way that you explain it or that you described it, the fact that Republicans change their attitudes much more rapidly and, in a definite direction than Democrats. And, there's some Democratic movement. We haven't talked about behavior very much, and we're going to run out of time. But, we are seeing that Democrats are doing more. Mm-hmm. Yeah. They're not doing as much as Republicans. They're shifting, in a more active, more, direction towards more careful public activity. Mm-hmm. Where I would say, Republicans are ahead of that curve and, shifting into more careless, public activity, or, back, what we, careless as being, a little sharp, but basically huge share of Republicans report now just be coming and going as normally from their home.
Careless might actually be the most accurate way to describe it.
No, I think it's, it's
just to be fair.
Yeah, I think that's right.
And not as a pejorative or a dig.
Right, as being very literal. And that's kind of how I backed into that language, right? Yeah, if we say, Democrats, Republicans or Democrats are still being, more careful,
right.
I guess we could say carefree. But so if that's, so in that sense, I think, that's an interesting pattern that we're seeing, and it's going to have a lot of implications as we go forward. And, you alluded to this, but, the list of behaviors that people see as that larger shares or majority shares of subgroups see as safe rather than unsafe is just getting longer and longer.
Right. And just to,
and to be fair, the Democratic list is longer this time too.
Right. I mean, but yeah, without getting to the political differences, we'll, on that, so we have time. Let's just do some quick summaries on the behavior, because I think it's worth talking about what this looked like. One of the questions we ask people is, regardless of the restriction in your area, basically, how are you living? And on one of the scales, you're living normally, coming and going as usual from your home. On the other end of your scale is basically you're just never leaving home. And just focusing on the people who said they're living normally. Back in April, only 9% of Texans in April of 2020 said that they were living normally, coming and is going as usual. That's slowly ticked up over time within the context of some of those things we were talking about. Today, it's 33%. So 1 in 3 Texans. However, fewer than 10% of Texas Democrats still say they're living normally. In fact, it's only 8%. It's never gone above 10% over the 5 polls. Among Republicans, it started at 11, went to 32, 41, 40, and is up to 55% today. So half of Republicans voters in the state currently say they are living their lives normally, coming and going as usual. You see similar types of changes with like social distancing behaviors, for example. So whilst there's still, upwards of at least 64 to 80% of people basically engaging in social distancing, wearing masks, those kinds of things, it's always been above 90% for Democrats for all these behaviors. For Republicans, for example, wearing a mask at the beginning of the pandemic, 69%, went up to 78, 81. It's back down to 67. Avoiding large groups was at 80 at the beginning of the pandemic for Republicans, went to 73, 70, and is now at 56. So, this is where we are now. We are in the wind down, as you say. And one of the things I think, we need to dig into that I'm really interested in is, the relationship between, vaccine attitudes and vaccine, regimens, whether people have actually taken the vaccine and their behaviors right now and actions, because that's going to be interesting.
Right.
Whether the Republicans who are living freely are the ones who've gotten vaccinated or whether it's the ones who haven't.
Right. Well, hopefully we'll have that in the next couple of weeks.
Oh yeah.
So, I'm sure that'll get it. So, I think I'm going to ask you quickly. I mean, and this is like a lightning round because this will be like the subject of it, and we haven't looked at this enough, but like, first cut, I mean, this is almost like a hot take. I mean, if you stand back and say, okay, you can, because you've been, putting all the data together, what do you learn from this? What do you think we might have learned from this?
This is a little, I mean, like, I don't know why I'm even prefacing. I
gave you a lot of caveats there in the beginning. It's a
little big thing. I mean, the thing that I keep thinking about that I've sort of learned from this, from where we sit, so that's all I can say. I think the relationship between people's concerns and their behaviors is very complicated.
Yeah.
Right. I mean, I think that's the thing that I've really, sort of taken away from this, both from a polling perspective, but also from a public policy perspective, from a public health perspective, and a part of that is because, concern is a very odd emotion, right? It could be the cause of a lot of information or none. Yeah. And it can also change over time in terms of, the balance of again, those two factors. And then it's all taking place in this broader sort of political, environment. We have a campaign going on. We have mixed messages about what's happening. And, so, it's interesting to see where, the public's concern matched, let's say the concern being expressed by public health officials and affected their behavior consistently and where it didn't.
Yeah.
I think that's kind of the thing that I'm really sort of interested in going forward and trying to go back and learn a little bit more about the nature of it.
Yeah, the nexus of a particular emotional state and the behavior that we like to think is linked to it somehow.
Yeah, what have you learned?
Well, I think I've learned something obvious. Honestly, is I mean, right now, and again, I think as we dig into this more, I'll think more. But to me, I am still pretty astounded at the degree to which partisanship really was so fundamental to people's perceptions and behavior in this. Mm-hmm. As much as we tried to qualify that at various points so that, frankly, it didn't seem like we were blaming Republicans for being, careless or, indifferent, which they weren't, and by and large. Well, but nonetheless, I mean, and I think we've internalized it already, and I think that's what I'm almost trying to backtrack a little bit in terms of my own processing of it. Mm-hmm. But and I think it's too easy in retrospect to go, well, of course. of course, why would this be any different? But I think as we saw people begin to die in significant numbers, I'm trying to not be jaded about this or, intellectually defensive and go, oh yeah, well, of course, partisanship is different. I mean, to me, it's really kind of interesting and fundamentally meaningful that something this fundamental and this much of a disruptive social crisis with such human costs was so easily vectored by partisanship by at least some people, and by some people, I mean, look, some Democrats were guilty of various things at points in this, but the degree to which partisanship really fueled a lot of denial about this that I think is not going to go away. It's fundamentally really, really interesting to me.
I wonder how much, like one of the things, there's two things I think about when I hear you say that is one, I agree. And I think, the first is sort of, you think about how many deaths we've experienced through the COVID. You saw these sort of graphics come on occasion, like, hey, how many fewer people died in 9/11? And that immediately mobilized the country 90% behind whatever, right? How many people have died in world wars? And, you start going, geez, this is like a huge thing. And I wonder if it's the fact that it happened slowly. I mean, it's been a long year, right? But the fact that, it's kind of rolled out over time. So on the one hand, I think there's sort of a difference in terms of the shock value of it, right? I mean, ultimately, we didn't get to a point where we were rationing care in the hospitals and choosing who was going to live and who was going to die. And I think that probably, made a difference. But at the same time, when you're saying, hey, we're having a 9/11 every day in terms of deaths. And, the answer from, again, going to partisanship from one side is, no, we're not. Those numbers are wrong. And it's like, what? I don't know what to do with that.
There are a lot of things that, to explain here, and we've engaged some of these things as we've gone through it. Mm-hmm. But, you ask me, what have I learned? It's like, that we are in a real fundamentally interesting world about in terms of the way that the people can engage in the kind of cognitive leaps and twists and turns that you were just kind of referred to a couple of them. And, I think one of the things of decomposing all this data and thinking about it and doing something with this on kind of as a project scale, obviously is going to, that's going to be a big piece of it. Right. So I think with that, I want to thank Josh for being here. I want to urge listeners to keep an eye out. The Texas Tribune today rolled out. There's a whole other couple of clumps of data that are very interesting that came out in the Tribune today.
Nothing hot though, right?
Nothing hot, just election reform and voting. So, have a look at that. Have a look at the data on this. We will be rolling stuff out as always at the Texas Politics Project website, texaspolitics.utexas.edu. And, keep an eye out on the Tribune Monday and Tuesday morning. There'll be other waves of this. Not giving away too much, I don't think. Monday will be tons and tons of stuff if you follow the Texas legislature and the fundamental issues that are being engaged there and what has been, speaking of expectations, a very active session legislatively so far. There's a lot going on. We polled a lot of that. There are a lot of fascinating results in that. And then later in the week, we'll have, the usual things like approval levels of political leaders, other issue polling, some national stuff. So keep an eye out. Thanks for listening. Thanks to our crew in the Liberal Arts Development Studio in the College of Liberal Arts at the University of Texas at Austin. Be well. If you haven't gotten it, just get a shot. Talk to you next week. The Second Reading Podcast is a production of the Texas Politics Project at the University of Texas at Austin.